Good with that, Carol Ann?
Yes.
Okay, great. Well, good evening, everyone. Welcome to the first ever virtual meeting of the Community Board 2 Health, Environment, and Social Services Committee meeting. My name is Brandon Smith. I'm the chair of the committee. We'll have each member of the committee and the board introduce themselves. Jessica?
Hi, I'm Jessica Thurston. I'm the secretary.
Alejandro?
Alejandro Varela, once a full board member, now a public member.
We're happy to have you however you come, Alejandro. Barry?
Barry Newmark, public member.
Okay. Victor?
Victor, public member now.
Joining Victor. Tanya?
Tanya Richardson.
Thanks for joining. Nice to see you. So we also have some board members here tonight. Betty, you want to introduce yourself?
Good evening, everyone. Betty Freibush, Youth Education, Cultural Affairs. Glad to be with you tonight.
Latrell?
Latrell Masso, community board member.
Thank you for coming, Latrell. Carol Ann, do you want to introduce yourself?
Carol Ann Church, Assistant District Manager.
I think we can get started with the meeting. And I'm sorry if I forgot anyone, but I think I got everybody who's a board member.
Taya.
Oh, Taya, sorry, Taya. Do you want to introduce yourself really quickly?
I'm not a board member. Taya Miller, Taya Miller, greenest member of the district staff office. Very happy to be here to support you.
Very happy to have you.
You said
This is Taya Miller. I'm the newest member of the Brooklyn of the CB2 district staff.
Oh, okay.
Hello.
Hello.
I hope you all get the chance to meet our new district office staff. You know, some of you may not have gotten the chance because they were hired and started right around the time when this COVID-19 outbreak hit. But I'm sure we'll get to know each other and work together quite a bit in the future. So thanks for joining and helping, particularly with the tech aspects. Yeah. Going into tonight's meeting, I'm happy to note that we're supposed to be joined by a representative from Brooklyn Medical Plaza to give an update on their coronavirus. I don't believe they're with us at this point, but I would assume that they'll be joining at some point during the meeting. With that small caveat, and that we'll try to make accommodation of them when they come in, could I have a motion to approve the agenda?
Second.
Well, we gotta have a motion first. Does somebody want to make the motion?
Alejandro.
Tanya Richardson, make a motion.
Okay. I got Alejandro and I got Tanya. So let's give Alejandro and Tanya the motion and the second. And I'm sorry whoever who I didn't give the second to previously, but we all have consensus around the agenda.
I
Any
lost
objections?
y'all. Oh shit. Oh.
Was that an objection to the agenda, Tanya, or no?
No. I pushed up. I mean, I lost y'all. You guys, I'm sorry.
We're happy to have you. Okay. I think we can consider tonight's agenda approved. Our initial item after approval of the agenda is review of ideas for presentations and projects. This should be a pretty interesting topic. Some of you may recall from the February meeting, I believe, we had agreed and voted on a potential project to explore as a committee where we would look to assist the barbershops around our community with providing healthcare services to Black men and particularly blood pressure type health services. And I think there were a number of things that we were going to iron out from there. And then we have the COVID-19 pandemic hit. So it sort of takes us to a point of we're here now. We've had that one project discussion. How is everybody feeling regarding the potential projects for our committee and with and maybe even about that project, you know, because certainly we're in sort of a different world now. Caroline, would you know about where we left off with that? Like, did we do anything after the last meeting, and where would we be now with the barbershop thing?
Am I on? Yeah, we didn't move forward. I believe that we stopped at wanting to learn more about the initial project. I have since heard that there are other initiatives similar, even here in Brooklyn. And my feeling at this point is maybe we could reach out to someone who's doing that work right here in Brooklyn, just because it's sort of closer to home, and get some lessons from there.
Okay. So I think that's good, and maybe we should table this for a minute because I see we've been joined by LaZetta Duncan-Moore, who's from the Brooklyn Plaza Medical Center. Ms. Moore, do you believe that, are you on the line? You can hear us, we can hear and see you?
Webex and Zoom, it's a challenge for me.
Well, certainly, I'm happy we got you. I can see you, I can hear you, and
Very good.
you're definitely
Thank you all.
adept at that. And thank you for coming. Really happy to have you. As our community health center, I think really interested to hear about how things have been going there and talk about whatever updates that you have. So I'll turn the floor over to you.
Thank you so much, Brandon. And thank you immensely, Caroline, for being patient with me. I told Caroline that I would be on at 6. And 6, I was over here going, oh, goodness. But it has been quite an experience. First, let me begin by letting you all know that I was infected with the virus, and that happened back in March. But I'm doing very well, so I have a lot to share. One of the things that was very interesting early on, because we got tested very early. I made it my business to. I mean, one of the very first things from my background was that we needed to be prepared. We needed to be ready, and you know, through the reading, we knew the pandemic was in Washington. So the idea was we needed tests, and we need test kits right away. So we were able to get test kits. I think we were one of the first centers, but we were only able to get about 15 to 20, something like that. So it was like, oh my God, we got them, but now we can't really say we got them because we didn't want a whole slew of folks. But we were ready. We had our emergency preparedness meetings. Some of you may know we don't have anymore, but we did have an individual that was totally assigned to handle emergency preparedness, whose background and training was with NYPD. So that was good, and they made sure that what might become necessary in terms of logistics was done, because we need separate areas, of course. in the event that someone presented. At that time, we were looking to present, if the individual presented, had a fever and a cough, of course, right away, we had to send them to another, put them into an isolation place and then do the testing. So now, fast forward to date, I can tell you that since in March, and let's remember, in March is when the pandemic really started to run rampant on the last 2 weeks. By March, we tested for that month 15 folks. Out of that 15, we got 5 positive. I can tell you that with those 5 positives, we had 4 were Black and 1 was Asian. Then, so keep in mind now, so March is when it starts to wrap. So we also, during the end of March, we were shut down. Okay, we didn't actually shut down, but we started having our people work from home, as many as possible. Some of the essential people continued to come in, but we were really, and it was a very good thing for us, because we had been working on a platform that would allow us to work from home. So many of our providers and the ones that were older and not interested in learning, we tried to really quickly teach them. So that's mainly how we did over the course of those over the course of the height of the pandemic. And of course, people weren't coming. So we did, in essence, we lost quite an initial amount of visits. We did, however, we were able to reverse and start doing what we're doing now, and having our doctors, and a lot of them are savvy, and we use a platform that's called CyberMed. And this had been rolling out. This rolled out maybe about 2 months, 3 months before this happened. So it was just it was a big challenge, because we had an internist that had not, wasn't interested. But again, we started revving up, and some of our providers that are a little older and not interested in doing it, we were able to feed them along. By April, we tested, let's see, where are my numbers on April? It says we tested, doesn't look like we tested a lot in April. We tested 5, oh, I'm sorry, we tested 11 in April, and we came up with 5 positives. May, of course, we're revving up, people are coming out again. So May, we ended the month by testing 28. And out of those 28, 1 was positive. So that's how we're looking. We still have, we now have tests. We also have the antibodies test. So some of the things going forward, I can only say that this is something none of us have ever seen. This is the first time. However, to have saved lives, and I can't tell you how many of our patients passed away. I wasn't able to get that information. But I can tell you that if we, as those like as myself in the leadership positions and calling meetings, had we had more information and really consume that information, I mean, we could have been in some a much better place. But you woulda, coulda, shoulda. And I say that because even when the people started to present, even if they weren't sick, we could have had information available to let them know that if your temperature starts going up in another 14 days, 12 days, this is what you need to do. So how many of these people came to us, didn't show symptoms, we didn't test? So many of the people, let's say, that may have come in, if they didn't show it, if they didn't have a temperature, or if they weren't coughing, both of them, we weren't giving them the test. Does that mean that that person walks away from us and 5 days later, they're having symptoms? They might not even be able to get back to us. And we don't know if they're underlying conditions, asthma. So I don't want to, I'm still very, I'm very emotional about it, because I think we could have saved in our healthcare field. We could have done a lot better. Those that walked away again and maybe showed symptoms, then I think we could have given them a thermometer. We could have had little kits prepared and say, now, you're not showing symptoms now, or all you have is a cough, but we need you to continue to take your temperature. We need you see, these are not, this is not rocket science, but by the time most of us got hit, even when I got hit, you couldn't find a thermometer. Thermometers were gone. You couldn't find Tylenol. So, just rethinking it, some of the things, I think, when it comes to health in our communities, we really have to press that we get as much information out as possible. I walked into the office, I think it was the 1st of March, maybe second week of March, first week, and I said, where are the tests? I need you all to call the state, find out where we can get these tests. The secretary told me 20 minutes later, she says, there's no such thing as test kits. Now, I'm like, who did you call? But this is how limited the information, how miscommunication. So it gotta be tests. There has to be, We started out, another thing, some of us were wearing masks, and this was medical protocol from our infectious people, because they didn't know anymore at that time. Only wear the mask if you are the patient. Employees don't have to wear the mask, and we don't want to upset folks. See, so that with this particular epidemic, all of us needed to be masked up, right? I'll be quiet and have you all ask me questions now.
Thank you. I appreciate you giving your perspective. And I'm sure the committee will have some questions for you. I think one thing I would just want to ask off the bat is the services that you have now. I mean, granted, we're this thing ain't over completely as an issue. What's the message now in terms of availability of testing, of antibody testing, or just testing for the virus for the community, for the patients, and you all doing outreach to the people who come in to encourage people to come in for this, or is there still sort of a shortage of tests to provide to people?
We are testing. We continue to test, and we are doing the antibodies test. I can get back to you with exactly what the supply is. Remember, I'm still working from home myself. So they are, we've been talking with Assemblyman Mosley, who has designated Brooklyn Plaza as one of the sites for the drive-through testing. We have some kind of stall there. I'll check in with this office again tomorrow. But we're looking forward to doing that. The state comes with all the supplies and the test, and they come with staff. So that's a good thing. So we are looking to do that if we can. At this point, we don't have the bandwidth to ourselves as the plaza to do the drive-through. The outreach, we have not started going face to face, but I'm sure calls can be made. Carol Ann, you may recall one of our outreach workers, Terry or Ethel McKenzie. We lost her. She passed away. Now we don't know
about that.
Right. We don't know whether it was COVID related, but we know she had some serious underlying health issues, and she was actually working from home. So we're now short. We have a shortage, but we do have folks that have been doing mental health, which we have available. We are doing, the last time I think I met with you all at Brooklyn Hospital was when we were looking to integrate mental health, a mental health program, or we call it behavioral health. So we have that program in full effect. So we do have screening, and most of that team, call them navigators and whatnot, they're doing phone outreaches, but we haven't been sending folks out as of yet.
Okay. And one other thing I wanted to ask you about, and it's fine if you're not particularly familiar, but I saw on the website there's a description of a barbershop initiative that the medical center has been a part of. How familiar are you with that? And I imagine that can't be too active at the moment, given that the barbershops aren't even open. But I was wondering if you might give a little color as to when that got started and what the overall plan is.
Yes, that was an initiative. Really was started with Ethel Terry, the one that I was just speaking about that passed on. Was very successful, and I think we started it maybe 4 years ago. I'm approximating, and it was also heavily supported through Assemblyman Mosley. I can speak to the team and see, you know, even if we don't start until September, when people feel safe, I don't know, but that's something that, yeah, but it was very successful. We enjoyed doing it. We would send a medical assistant, and sometimes a doc would stop in. And of course, we would have our outreach person to set it all up.
That's great. Well, I don't want to ask all of the questions, so I'll ask the members of the committee.
No,
I don't know. I know we have a way of. I know that it's kind of difficult in web format for you to raise your hand, but if you could just chat that you want to raise a question, then we can probably I can probably call on you and we can get you to raise your question.
I see Mr. Alejandro. Yes.
Oh, okay, Mr. Alejandro has a question.
Yeah.
For some reason I can't even see it, but I gladly will give the floor to you.
I tried to message and I honestly couldn't figure it out. First, I have to apologize in advance because my kids are nearby. It's a small apartment and I can't escape them, so you may hear them. Hi, yes, you understand.
It's a grandson.
Secondly, I want to say, Ms. Duncan-Moore, thank you for your presentation. I'm really glad that you're feeling better, and I'm sorry for the loss of your colleague. Just two follow-up questions. One, are the antibody tests and the COVID tests, are they free of charge for your patients? Who's covering them? What do you know about that? And number two, the information that comes in that's been sort of at a lag, as you were describing, sort of hearing about everything a bit too late, about procedures and stuff. What's the primary source of that information? Is the CDC communicating through some sort of consortium? How are you getting that information? Thank you.
Right. Okay. I'll find out if the test, but I know the testing, I think I'll make sure that I'm correct here, but I'm almost certain it's free. Okay. Now, if you have commercial insurance, maybe it's not, I'm not sure, but I'm almost certain I'm almost certain it's free. And I say that because we had written several grants during this time, and we were able, because we were in very good shape at the time, we were able to get several federal awards to help us, to sustain us. Okay, I will check though. So the antibodies, but I'm almost sure they are both free. But I'll get back to Carol Ann maybe and let you all know. What was your second question? I'm sorry.
It was about the source of information for how, yeah.
Okay. So the source of information comes in the CDC, of course. That's our primary source. I mean, when it comes to something like this. Secondary source in this state is Department of Health. Okay. Outside of that, for me as a CEO, then I'm monitoring the world health. Okay, so I'm looking at every source of information, from the web to the television. I'm checking and cross-checking. I'm seeing what's going on in Italy. I'm seeing what's happening in Spain. So and you put all of that together with what we're getting. So that's how that's how I do it. I mean, only because, again, my background is emergency stuff.
Thank you for that answer, and thank you for all your work.
Any other questions from the members of the committee?
I have a quick question.
Sure.
Hi, how are you, Jessica?
Hi, thank you so much for that presentation. I have a question about the antibody test. My perception is that there's some misinformation, or people are unclear on whether or not if they take the test and are found to have antibodies, some people think that means they're immune and can go get on a flight and go on vacation. And I'm curious, that feels alarming to me, but I'm curious what the message is to patients about the efficacy of antibody testing, and if there's anything we can do to help clarify that for the community.
Okay, so the antibodies, that testing, from what I'm seeing, can very well tell you if you have had the virus or if you've never been exposed or had the virus. Short of that, I don't think we have enough evidence to say that it says anything else.
Right.
I'm just gonna be, because there's no data yet. I mean, not enough to tell us that you can't be infected again, that you are protected. So I would, for instance, for me, I haven't even taken the antibodies test. I'll divulge. However, I intend to, because I got 2 new little grandchildren. I mean, brand new. They're like 3 months and 6 months. So the antibodies, if it at this point will say that I'm positive or I've been exposed, we understand. We would know. Yes, we know I've been exposed. The idea now is, am I still shedding, so to speak? Am I still giving off? And it shouldn't, and it should not be. So that's the deal. I should not any longer be, for a better word, I shouldn't be contaminated. I think she put herself on mute, or did I? Jessica?
Sorry about that, because I was typing. Yeah, a lot of where my question comes from is I feel like I'm hearing of people who get the test and they say, okay, so I'm all clear. And to me, I think we need more like public health statements saying like, no, you need to act as though you have not had it. And that's difficult because it's
I mean, at best, my thing is, I would say it's not active.
Right.
You're not active. You're not, it appears that you're not passing on the virus. And that's a good thing.
Yeah.
Yeah, but anything past that,
we don't know.
I don't know. We don't have the data.
Yep. Thank you.
Yes, you all are so good. Miss Barry, Mr. Newman. No, Mark.
Mark, you have a question? I don't know. LaZetta can see some things that I can't see. So
You're on mute, Barry.
You said that you're not very good at this Webex, but you're better than I am, I'm finding.
Barry, you're muted.
Did you have a question?
Yes, Mr. Newmark has a question.
You're muted, Barry.
We can't hear you, Barry.
He's muted.
Thank you, Brandon. And Brandon, thank you. And thank you, LaZetta, for recognizing me. I wanted to thank you again for your presentation. I thought it was very informative, and I really was touched by what you talked about early on in terms of, had more information and accurate information been available, the difference that could have made in lives. So I really share your anguish about that, and I appreciate your sharing it with us as well. I just wanted to tell everybody, and if need be, I can forward the email to you. I get emails for a variety of different reasons from DOHMH, and DOHMH sent out yesterday information about diagnostic testing, which is free of charge in the city of New York. There are over 150 test sites, and there's a link to a web page in your address, it tells you what locations are close to you. I just quickly did that again, and LaZetta, your location's not
there?
it's not there as part of the sites, but the sites that are listed, the testing is free. And I assume that means not just the testing, but also the lab work on the testing.
Right.
So I just wanted to let you know that if anybody wants that email, I can send it to Carol Ann and she can send it around to everybody.
Very good. Very good. I'm not so sure. Thank you so much.
I'll do that. I'll do that later.
Thank you.
The other thing is that, of course, in a perfect world, people could be tested periodically, because you can test negative today and you can test positive tomorrow.
That's right. That is so correct.
All right, I see Tanya raising your hand in the old-fashioned way. Nice to see you. Do you have a question? You got to unmute.
She is on mute as well.
I thought
There we
you
go.
did that. Hi, Ms. Moore.
Hi.
Blessings that you're fine. I'm glad to know that, and my condolences to the staff worker that you lost. So I was reading today. Actually, I applied for the tracker position, and as you were saying that they're going to bring people in and make phone calls and so forth. So it's also because a lot of people is not asking questions or answering questions. So I want to know how, just like how everything was jumped in, and you said they didn't have like the testing kits and this and that, because it was and I get it, it was a lot to endure at one time. So do you know if this is phase 2, I guess? This is what I'm gonna call it.
Yeah.
So is phase 2 more organized? Do you think that this is something that they just throwing together again?
Well, the tracing, I'm gonna lean toward being more organized, and I'll tell you why. Because we have been watching very closely the governor, who is very pragmatic.
Yes.
All right. So I would think then the CDC and their tracing efforts and DOH will also be pragmatic.
Okay.
I do believe that they're going to, they'll have it much more. I can't see it being thrown together.
Okay.
I mean, I would hope not. So.
Okay. And also, on the project of the barbershop.
Yes.
I had spoke to a couple of barbers at the, before everything, that was interested in the program, the project that we wanted to do.
Yes.
So perhaps we could
get it going again. That's excellent. I'm really glad to hear that.
Yeah, I did. I think that the best thing to do through everything is just to keep working, and for everybody to keep motivating, so things can get to some type of normalcy.
Yes.
Yes.
I will definitely do that. I will definitely look into to doing that. Now, I think I did mention this to Carol Ann, I hope, that my position now, I am transitioning and going to do a lot of work behind the scenes. And so I'm now what we call the CEO Emeritus. And yeah, and come July 1st, I will be a consultant working on several different projects for Brooklyn Plaza and other projects, of course. The new incoming CEO, who I'll talk to about what we've discussed. His name is Philip Honorato. The board has selected Philip Honorato. Not sure. Oh, God bless you.
Thank you.
So we also have a Dr. Kernesant. I'll pass all the information on to you all. But of course, as we have a large project in Crown Heights, so a lot of my energy is going to be focused on that. And of course, as it stands, I don't want to take on too much at this juncture in my life. I want to try to live till I'm 90.
As you should. Good for you.
That's all I can say. Yeah.
Yeah.
Yeah, exactly. You know, I'll share a little bit more with you. You know, I was one of the first, I was that first responder with 9/11. And I have some issues from that. I did 22 years with the police department. And I said, you know, God has brought me a long way. So I've overcome that. So I'm moving into transition into a bit more of a different role, but still very much attached to Brooklyn Plaza.
I have a question.
Okay.
Ms. Church.
Yes, hi. I can't see you, but you can see me, so that's great. Can you hear me?
Yes.
I'm unmuted. Thank you again for your presentation, and I'm really sorry to hear about Ethel. We did a couple projects together in Fort Greene Park, and I'm saddened to hear that she's passed on. You mentioned that it would have been useful if you had kits that maybe contained some Tylenol, a thermometer, and in my head, maybe even an oximeter. And it's possible there might be a second wave, right, with the protests before we're completely cleared, probably being a primary catalyst for that. Do you think that that's, if the numbers begin to rise again, do you think that that's something that will be ready? Would hospitals, I mean, is there like a broader conversation among healthcare professionals like yourself about having things like that ready?
It's interesting. We're having a discussion statewide tomorrow. And that's one of the things that I will bring up. One of the issues, well, it's not really an issue. I think the idea is we can make the kits ourselves, right? We can just get or acquire a substantial source of Tylenol and hand sanitizers and the thermometer, which is very, very important for this pandemic. Thermometer is absolutely essential. So yeah, so we'll be with a group of statewide FQHCs, such as Brooklyn Plaza, and that's one of the things that we will bring up.
Okay, and one more quick question. Thinking Barbershop again. Who should I be speaking to over at the Plaza?
I'll speak with Philip. And Philip had come to a few of the community board meetings. Excuse me. And then we'll see
if you want to do it again.
Right. But I'm going to strongly encourage him to do that. I'll be trying to go like, oh, please. You know, yeah. The idea is getting, we're going to have, even if we, again, look at September, because now we're in the process of getting our staff back. So we're trying to get WIF back online. WIF is the site that's over in the public housing area. So that site, we actually consolidated our site once the pandemic hit. That was out. So now getting everybody back in, or having to hire some more people. Thanks.
Thank you very much. I did just want to, typically we will ask if anybody else has any questions. Victor, did you have any questions? I want to make sure your voice is heard if you want.
Well, I actually went for the COVID-19 testing myself at my own hospital. Yes, it is free. One of the guys who wanted to go and said, well, if you don't deal with people that much, you don't need to go get it again. You got it once, you're fine. Because I work in a whole company where everybody is like right near each other because of the fact that we all have to be near each other so we can get the stuff on the conveyor, we can get the stuff packaged. Because without us, the stuff is not going to ship. So we don't have a choice but to be near each other. Because if we're not, then you got to walk over there, you got to walk over here. So our company policy is that we have to wear masks while we're in the building when we eat. So
that's good. So the mask, I mean, from what the data shows, is again the virus is airborne, and the main catalyst is through sneezing, coughing, speaking, singing. So wearing masks.
For other board members, Ms. Feibush or Luttrell, do you have any other questions that you wanted to raise for Ms. Duncan-Moore?
Hi, it's Betty Feibush here. I don't have a question, but I just want to put out that some of the plans for the barbershop are wonderful, and everyone should please consider including our committee's work. We're interested in putting out books and programs for the young men or all age men who are in the barbershop to read to children, to read to their young children, their grandchildren, etc. So this could be an area of collaboration.
Absolutely. Yes.
Thanks, Betty. For our members of the public who attended, I'm sorry if I don't know you but I just know you by the name that I've got here for you. Conry, Sonia, Eileen. Any other questions for Ms. Duncan-Moore?
No.
Okay. Great. Well,
Thank you.
thank you very much for your presentation. If we were in the room, we'd give you a big round of applause. And
Oh,
really,
you've been gracious host.
yeah, we're very happy to have you. We really appreciate the work that you're doing, because you are the heroes for the rest of us with the doing the frontline work and facing the virus head on. And I can't imagine what you had to go through yourself, but we're happy you're here to give your story to us. Thank you very much.
Bye-bye, everybody.
Bye-bye. All right. Moving along in the meeting agenda, we have been joined by one of our other committee members, Mr. Harrison. Are you on the line? Can you hear us? Can you speak to us?
Loud and clear. Loud and clear.
Okay. We'll take you. As much as we love to see you, good enough. Let's see.
You can't see me. Here I am. You see me now?
No.
Oh. Well, I have to apologize. I got home from my job about 1:30, and I was experiencing many technical difficulties, which Renwick helped me out with, but apparently video is still one of them.
That's fair. I'm just seeing a big B. So I'm good with, I'm okay with that. We can move along. You get the video figured out. We'd love to see you, but I want to get the meeting moving along so we can get to the next part on our agenda. So we were discussing the presentations and projects, and I think we've gotten a little bit more color because I really didn't know last time we spoke about it that the Brooklyn Plaza was doing a similar sort of barbershop thing. And it sounds like they're going to make an attempt to get this thing going again in September. I mean, I'm assuming that's really just like, how much do any of us know where the world is going to be in September, given that, you know, we don't know if we're going to have a second wave at, you know, 2 days from now, or 2 weeks from now, or 3 months from now, or ever again. But to the extent that we have this project, I did want to talk to folks on the committee, and maybe you, Tanya. Sorry, my
We're getting notice of the citywide curfew starting at 8 o'clock.
Luckily, that won't affect any of us.
Speak for yourself, Brad.
All right, I won't be presumptuous. I'm sorry, John.
It has major here.
I can imagine. Down in, but back on the barbershop project, I'm still trying to get my hands around, like, what exactly are we going to do to assist with this project? Is it that we're going to give the money to support their efforts? Because it seems like they have doctors and medical staff who go out to the barbershops. Or is there some other kind of support that we're going to give? Have we had any thought around this? Tanya, oh, I can see Mr. Harrison now. Tanya, have you had any thoughts around this?
Yes. First, we're gonna have to sit down and have a meeting and get a effective plan. So I think that we need to pull the resources together, first of all, to and see what type of screenings that we want to do as far as what was it, hypertension, diabetes testing. So it's going to be like pre-screening tested, and I guess now the COVID.
I agree. We need to figure out what's actually within the capacity of this committee to do it. And I don't know, Caroline, if I'd be curious what would be helpful from us. Is it like a list of questions for the office and Lenny about like what's feasible? Because I don't, like we had talked at our last in-person meeting, I don't want to reinvent a program that exists too.
At the time we spoke of it, I wasn't aware that anyone in Brooklyn was doing it. And so the idea I had was that we would coordinate it because we're not healthcare professionals, right? We wouldn't even know what to say, how to set them up.
No, give me the knife.
So I thought that it was a project we could work with, say, St. Joseph's College or LIU, because they run professional programs. They look for community projects for their students, senior year students, and that this would have been a great project for them to work on. So our role in my head was that we were going to bring the parties together and coordinate them. My experience on the projects that I've done in the past, I've never needed any money. With COVID, that might change because everybody was, you know, businesses on Myrtle Avenue provided meals or food or snacks. St. Joseph's College has been one of my supporters for any idea I came up with. Myrtle Avenue bid has always also been supportive. So we've never had to put money out. We've just printed stuff as a regular office initiative. So my view of the project was that we would coordinate it. The professionals would tell us what they need, how they need it, and we'd bring them all together and have it go.
Carol Ann,
Yes.
that sounds like a great idea. I'm getting it much more
I
so
would
than
also like,
when we've discussed it in the past.
I would like to add that whatever initiative, there've been other initiatives in other communities to bring library books and free books, like for little kids, to the barbershops. So we could be part of that dialogue and planning.
I think what I'm hearing is that we're going to be coordinating some people together, potentially people from LIU and potentially. I'm trying to sort of, I guess, connect the dots a little bit more than this in terms of what we're going to be doing specifically to coordinate them. But I think it's. Is it that we need to identify more barbershops and maybe work with Brooklyn Plaza to provide the services? Do we think Brooklyn Plaza now might be the provider that we might work with? Seem to have sort of a project in this area, and maybe we can give them a little bit more destination.
I mean, that sounds good. Our committee is going to be talking to Book Bodega or Brooklyn Book Bodega that distributes books for little kids, so we could get them involved as well.
I appreciate your support on your end, Betty. For the folks on our committee, I mean, I don't want to make it just feel like this is just a few folks who want to get the project done. We did vote to be interested in this, but it is fair now that we've had like the COVID epidemic to think about, is this the project, or is there other projects that we would want to think about? I guess to others, Alejandro, Barry.
Can I say something?
Yeah, sure.
Hi, this is Latrell. I think
Hi,
that's
Latrell.
Hi, I'm here. I think that's a great idea, especially for the community, because a lot of men are in denial about different health concerns. So by your committee, partnering up with any other committee or any other organization to go into the different barbershops in the community and speak to the men, I think that's a great idea, because some men are very in denial. They don't want to go to the doctors. They refuse to go. Their friend can pass away right next to them, and they still in denial. So I think that's a great idea and a great initiative for our community. I want to add that.
Thank you. I think that I would agree. I think it does sound like a good initiative. I haven't really heard anything to the contrary, so I'm going to assume that we are largely still on board with moving forward on this project, and we should try to identify the next steps.
And my other question was, is the barbershops that they did work with, were they in our community? Tanya said that she found barbershops, and I assume it's in our community. So I'm not saying that we don't want to help other communities, but we also need to, to help our community also. Because we also have housed 3 projects in our community. So, that's something a lot of people goes to the barbershop in our community. So we also have to help, look at that too.
Yeah. So, Brandon, I have a. Everybody all right there?
That's.
Wow.
That's a thought.
Go ahead.
Oh, I'm sorry. Yeah, I'm sorry. I was saying that I thought what Latrell said was right on. I think it's I'm trying to find this in a in the gentlest way to say it, I think it's a new thing for the committee to be involved in something like this. I think because it's new and because it's kind of an action, that there's enough with just that whatever we do, I would be in favor of it being within the community district. It's certainly in the area, in the borough, I guess. But I think it's important enough, and it's there's enough involved in doing this that I think it would be best to attempt at least to concentrate it, serve the community rather than be a barbershop elsewhere.
Brandon, it's Alejandro. I'd like to say something.
You got the floor.
As you know, I think I've said this before. I wasn't at the last meeting, but the previous one that I'm supportive of the initiative. I think it's great. A long time ago in grad school, I worked on a barbershop initiative in Seattle, Washington, where there was a lot of health outreach done, a lot of diagnostic tests, screening, information. I'd love to see that, be more widespread here. Also talk about not just diagnosing illness and education around, but also talk about what healing looks like, in these spaces. There's been a lot of stress, a lot of fear, and so I just think there are avenues and opportunities for this to be something else. However, I like the idea of us being a coordinator, and I think that is what we're best set up to do. I still see a lot of legwork that needs to happen in order for us to coordinate, which is to say, how do we identify the existing programs out there? And if they already exist, is our role going to be to essentially approach every barbershop in our community and try to get them on board? But then we have to look at what staffing is available. If the primary program is coming through the Fulton Plaza, then that's going to be limited, right?
That's a fair point. I mean, logistically, when we're figuring out the project, we need to figure out what are the barbershops we want to target. Seems like we're going to target barbershops in this community district. And from there, who's going to be providing the medical services? Seems like we have an option with Brooklyn Plaza, and perhaps maybe there are other options, but we'll have to see. I think, was it you, Carol Ann, who mentioned LIH and LIU, and I was just wondering what role did you see them playing?
Because they're a health science school, and even the hospital, I mean, we have, I think, quite a few options to go to for a partnership. It doesn't have to be Brooklyn Medical Plaza. Doctors, residents, medical students in the last year, they need these kind of things to do. And we can facilitate that partnership. It's I don't know if you remember, or if you were on the board then, when I was working on project with the naturally occurring retirement communities in our district. And that's one of the things we did.
Yes, I remember.
Yes, we had a day where they learned to use a smartphone or a tablet. We had a session on chair exercises and how to fall if you're an older person and you're falling, so you don't hurt yourself. We've had a tour of Fort Greene Park and a morning of exercises. And Alejandro came out even though it was like 25 degrees that morning in May. So we have lots of avenues for partnerships in the district. And as Alejandro mentioned, healing. Well, what does that look like? Well, we have yoga studios. Sometimes it's just a conversation, and you find you have a partner. They'll say, okay, once every 2 weeks, I can have a session that caters to this group. So stuff like that. You know, doesn't have to be perfect. It just has to be good.
So I have a question. Is this is the concept here, or is the idea here that the actions will be happening at the barbershop, or will the barbershop be kind of a springboard or informational, in which information is and referrals are made out to various partners, or is it where either representatives of partners or representatives of other entities shots would be coming into that location and doing things? What's the thought on that?
Let me take a stab at that. This isn't a cop-out, but again, I think that we don't have the expertise, except for maybe Alejandro, on this matter. And that's how it actually works out should be a decision left up to the people who are willing to partner with us, the health professionals. Like, how best do they see this working?
Okay. The reason I ask is because Betty was talking about books, and people have health, others. It's a while back, and I guess I'm getting older and maybe more senile, but I remembered some things that were very kind of hands-on-ish, and then some things that were sort of out there and kind of cerebral or maybe undefined. And so that's why I'm asking the question, because I think it might be helpful for us, rather than have the tail wag the dog, for the dog to wag the tail. So if we kind of decide what we're thinking about, then when we approach these partners or these other entities, then we could sort of feel them out on what our things are. And they might say, no, that wouldn't work. You're better off doing it this way. I raised it because I think that's a big thing in how it shakes down both operationally and conceptually. Any thoughts on that, Brandon?
I think if we wanted to make this happen, we would basically break this down into a couple of actions. Identify the barbershops, identify the providers, identify the services, and then bring the providers together with the barbershops and the services. So kind of like 4 different actions.
Does that mean you see the services happening at the barbershops or elsewhere?
I think how it's been described, I would see the services at the barbershops. I don't see where else would they be. I don't think the idea is to bring people. The whole concept of this is the fact that the barbershops are representing a community aspect, and that we have to go out to them to bring these services, because it makes the people feel more comfortable when they're in a more relaxed setting that's provided by the barbershop. So it kind of doesn't work unless it's being done at the barbershop, I think.
Okay, so one of the things that comes to mind with that, the more kind of a health thing, is the whole thing that the partner would know. The barbershop would certainly know, but there are things that just, I mean, I'm not trying to be a naysayer. I think that's a good thing, what you said, because it brings clarity to me. We have to, people will know, whether those people are the partners or the people of the barbershops, what can legally be done, what can operationally be done. But it helps me out, because it just sort of defines what we see, if that's what you're saying. I'm fine with that. It's just that let's say there's a that's on Myrtle and Carlton, and we want to bring in health partners, and the barbershop's a very busy barbershop, and so they get that may preclude a health partner from maybe not doing some things or having to sort of tweak what they do so that it fits in there. Versus what I hear Betty saying, which is it's I'm not trying to simplify it, Betty, but what I heard is it's sort of like getting a lot of books in, which I love books, and they could go anywhere. You know, that's not a big thing. I don't know that if we're not doing other things, are we going to do also kind of legal workshops? Are we going to do kind of things that are outreach for development or education? I'm sort of putting that out there.
If I may.
Barry, I see your hand, or I went in the wrong view, so I didn't hear if that was someone else who said that other than Barry. I just saw Barry's hand.
Yeah, thank you. I just wanted to, I know Alejandro, you had something to say, and you, as somebody else pointed out, probably know more about this than any of us sitting here tonight. But it seems to me that first thing you do is an assessment of the situation. And by that, I mean, we have a benefit of being able to talk with the Brooklyn Plaza group that's been doing this already from the provider side to get more of a sense from them of not only what they do, but how they got started. What did they do? What questions did they ask? How did they introduce themselves to the barbershops? The second piece is you want to ask the barbershops, what do they think would be helpful for their clientele? I think in walking in with a set menu is a very bad idea. I think we need to ask them, because they're the key players in this. What do they think their customers would be interested in, comfortable in, and what they, as the setting owner, would be comfortable and think is feasible in terms of this kind of outreach. I mean, we can always give a little, brief description of what we have in mind, but that doesn't mean it's the be all end all. But to do all of this, somebody else said before, it might have been John, you, we're going to need a lot of people to be able to do this kind of stuff. And I couldn't agree with Carol Ann more that this could be a fabulous learning opportunity for public education, public health students, community health students, community organizing students. This is a great opportunity for those kids to learn how to do something like this. So I think partnering with some of the schools like LIU or I don't know, St. Francis might do something, St. Joseph's might do something. I'm not sure if they're in our district or not, but it would be a really both are okay. Yeah. It would be a really good idea to get them connected in this piece. But so I mean, I think we could map it out. It's going to take a little time. I think we'd have to sit down, maybe outside a meeting like this, some of us who were willing to do it, to really, create the scheme of what we'd like to accomplish and what we need to do from our belief at this point in order to accomplish those goals. That's all I really wanted to say.
Okay. Alejandro, did you have something you wanted to add? I'm sorry to cut you off.
Oh, no, it's fine. I do have something to add. This is my second time speaking on this topic, so if there's someone who hasn't yet said something that wants to, I'm happy to wait. I'm going to jump in. So I want to echo what Barry said completely and underscore that in any kind of community-based project, it's essential that the community set the agenda, that if we just come in with an agenda, it could be a turnoff. That said, when you begin a relationship and people don't fully understand how it's going to work, it's okay to come in with a few topics and then from there to grow and see what people want. My understanding of this particular type of endeavor taking place in barbershops, health education, health promotion, where I learned it in grad school, it could be that someone would come in, was a relationship with the barbershop owner, or maybe a relationship with someone in the community, and they could be there for hours, ready to just talk about colonoscopies, like all day, just talk about colonoscopies. People come in, you walk them through the process, you explain what it's like, and that may be something that came out of a conversation with the barbershop owners or the community who's there regularly, who said this is something I want to know about, this is something I'm worried about, or it could be done based on an assessment of the area in terms of what are the 10 leading causes of death or mortality or morbidity. And so you say, okay, the thing to keep in mind in a gentrified community is that the barbershop may be something you travel back to, so you no longer live in that, necessarily in that community. And so these are just all questions we have to keep asking ourselves. And that only matters, what I mean is because if you're going to look at a geographic unit to assess health conditions and health issues, then that might not be representative of the community that comes to the barbershop, if that makes sense. So these are questions that we need to be asking ourselves. But yeah, to get John back to the point, what you asked earlier, what does it look like? That is in my experience, what it looks like. It doesn't have to be limited to that, but it is a lot of health, education, and promotion sort of by topic based on needs in that community.
Okay. I think we got a good amount of consensus around that.
Tanya has her hand up.
Tanya had her hand up, Brandon.
Thanks for letting me know. Go ahead, Tanya.
So as far as so how are we gonna get it out there? We're gonna do like a survey? Are we gonna see the statistics of the ratio of diabetes, hypertension, what else? Colon cancer, Alejandro, for you know, the African American men in the barbershop? Or I don't think that we need to gear it towards African Americans. I think we should just do it for just men in general. Okay. So then we can know which one to like to target to put it out there. And then what else? So that should be the start to gather the data, right? To gather the data, and then with the partners to start from there and pick a date. We need a deadline.
Or
And we need to know who all wants to be involved.
I think, yeah, we should try to get a hold of the partners, and we should try to get some data together. I really feel like the partners are key to this, because it's going to drive an element of our scope, and certainly identifying relevant barbershops is going to be an aspect of this too. Do we think that maybe we need to have a meeting with some of these providers, some of these other providers? Like we saw Brooklyn Hospital, but we saw Brooklyn Plaza, but maybe Brooklyn Hospital, maybe LIU.
Yeah, could we have one specifically about this? Is that then, or does it have to be part of our committee meeting, just from like the open meetings?
If it's committee business, then
Yeah.
we have to do it in the meetings. If it's we'll have to look into the details, because we want to make sure we're compliant with the open meetings. But we can touch base on email to figure out how we can meet and what we can do in that regard. I want to keep the discussion moving along, because we have a few other agenda items to get to tonight, and I don't want to shortchange any of them. But I do think like the key things are going to be providers and barbershops, because that's, if we're going to be collaborating these two, getting a list of them together is going to be a pretty big thing. to the extent that do we know now any barbershops that we want to bring into the fold? I thought maybe Tanya, you had known of some barbershops that you thought might go into the fold.
And I can I need to know like the area that we're gonna do and how many. So I figured how I was thinking that it will go. So say if how long we was going to run the project for, like if we did at say Nubia Cuts, and it would be screening of diabetes and hypertension, and then over this place it would be um, colon cancer and something else, and then another place maybe hypertension and some, and how many we wanted to be involved. We need to see how many we want to be involved. I already know of 2 locally, maybe 3. I had like a list and then, everything happened and then it was just on a pause. I'd be outside.
I think it might be good if we start small with like, 2 or 3,
Would that be the cap?
and really get a
Okay.
feel like how this might work before we start a revolution here in Brooklyn.
You mean a movement? Not a revolution.
That's a
Whatever you want to call it. Whatever you want to call it. I'm okay with it.
This would be a health movement for men.
Okay. I'm good with that. I'm happy with the movement. Maybe I was too I guess aspirational with the revolution, but I think it'd be great. I think it'd be great. All right. So I see a suggestion in the chat I can read that we reach out to all potential partners and work from there. Do we all agree with that as a good next step? I'm seeing the heads nod and the thumbs up. That's great. Wonderful.
Yeah.
All right. Let's move on to the next step in our agenda. District needs and budget priorities. Before we get there, I'm just going to ask, can we just, because I don't think we're going to get cut off from our meeting tonight, but I want to make sure we get the minutes approved before this. Has everybody had a chance to look at the minutes from our last meeting in the month of, oh, go ahead, Carol Ann. I see you waving your hand.
I'd just like to remind everyone who might have joined in a little late that the meeting is being recorded and will be posted to YouTube.
Okay.
Fine.
Good reminder.
Just a legal disclaimer.
Yes. Could I get a motion on the minutes from March, from our March meeting? Barry, second.
Accept that.
Second.
John is the second. Okay. Anybody have any issues, corrections, or concerns about the March minutes? Barry and I will take them personally as we work very hard on them together. Thank you, Barry, for stepping up last minute on those March minutes. I greatly appreciated it. And
thank you, Brandon, for fixing everything.
I also thank you. I think I had the virus then, so I'm glad that I did not make anyone.
I'm happy you didn't.
So thank you.
It makes me feel, it feels bad to say this. I'm happy you didn't come then, but yeah, it was a good meeting that time. Okay. Any objection to the March 2020 minutes being approved?
I'm going to abstain, Alejandro. I wasn't there and I didn't read them.
Okay.
Sorry.
Well, we're doing it by consensus, so your abstention is not officially noted, but you didn't have an objection either, so I think we're good with the minutes. Okay, district needs. Sorry to jump back and forth, but I want to make sure we get to each of our items. This is the next one. The interactive agenda has a link to the district needs statement, and I think we have to get this together by, is it September or October, Carol Ann?
September.
Is this our only shot to discuss them?
Looks like, right?
Yeah, you in the past, Jessica had given us a Google Doc.
Yeah, I can do that again so we can weigh in that way.
And there's also, oh, sorry.
No, go ahead.
Yeah, and also the staff has discussed potentially putting together some surveys now that we have more people participating since we're virtual. And so get some community feedback, or more community feedback than we've had in the past on issues that they see as critical. And so that when we meet in September, if folks put their ideas in, it can then be discussed openly in September and voted on.
Yeah, I think that that's a good idea. Is there any chance we can get the smorgasbord of all the agencies? I know that was the idea we had potentially for this meeting back before the COVID, but would that be logical in light of when we have to get these district needs done, Carol Ann?
I mean, we can speak to the leadership about possibly doing something in the summer, having a meeting in the summer. It's not unheard of. Although boards are generally in recess, but they do convene. Some probably choose to not have a recess. So it's something that would have to be presented to the leadership if the committee would like to have a meeting with agencies during the summer. It would probably have to be the August meeting, I think. When is July 4th?
Does anybody have an objection to meeting in August in the summer from the committee?
July 4th is a Saturday.
So Wednesday's the 1st. Yeah, we could aim for that, provided leadership don't have any issues with that.
Yeah, I'm okay with that, and fully in favor of checking with leadership. Sounds good. Okay. So we'll take the discussion offline then on district needs and encourage everybody to think about the post-COVID world. These district needs as we had them were not written in the COVID world, and if there's anything we want to think about or ask for with that in mind, I think that's something we should think about. I'm also going to think about the maternal mortality presentation we got back in March, because I found that to be a pretty interesting presentation. The extent that we can do anything to promote solving that problem and those issues be something to think about too.
Can I add something to that?
Sure.
As you know, or some of you know, I'm interested in food and food insecurity, which has really like just exploded in the COVID world. And I would suggest your committee or our committees jointly deal with food and food insecurity and the district needs, as well as in our committee meetings.
Yeah, I'm certainly on board with that, Betty.
Thank
Always
you.
found our partnerships to be pretty good, and I would love to work more with you on that issue.
Thank you.
Tanya?
I'll tell y'all I'm in the meeting. Hi. So I've been working with one community and MARP distributing food. I'm like, and I'm also, a part of the Farragut Food Club. So if you guys need any help or direction, holler at me. Okay. Thank you. That's the grandkids bothering me.
That's the beauty of having a video call. Jessica, is there something you want to add?
I stepped away for a second to grab my computer charger, but were we talking about potential topics to add to the statement, like what we'll discuss in the district statement needs?
Yeah, I think we were thinking about, I bet he had proposed both from the concept of district needs, but also in the concept of having our committees work together to address issues of food insecurity. So I think that
I just want to make sure I captured it correctly.
yeah, that's good.
I would also add, I know we always talk about education when we talk about the needs of the district, but sort of to my question about antibodies earlier, I feel like there's going to be, there is such confusion right now about the state of public health in the district and beyond. And so I don't know exactly what the recommendation should be, but something about pouring more money into like very simple district driven messages around COVID and other diseases that we know particularly affect the community. I know that's very difficult for the Department of Health, but as much as we can make them very centered on this district or at least on Brooklyn, I just think they'll resonate so much more. So I don't know what form that takes, but it's something I'm trying to think about.
Yeah, absolutely. I mean, that seems like an extremely all too real issue. It's almost like, where do you start with all the education that needs to be corrected? Because it's one thing to talk about the stuff that's happening now on the back end with the misinformation that's circling before the crisis. But don't we need to go back to all the agencies who didn't distribute the information thoroughly before the crisis or at the onset and make sure that there's funding provided and that there's training provided and that there's adequate education, there's adequate information provided between different agencies? What role should our city agencies, state agencies have in that regard? That's definitely something to think about.
Yeah.
That one, Brandon. I don't understand what you're referring to.
Well, as Ms. Moore just mentioned in her presentation earlier this evening, there was a profound lack of information that contributed to the level of preparedness that Brooklyn Plaza Medical Center had for dealing with COVID-19. They didn't get the information soon enough. They didn't get the information accurately enough. They didn't have enough tests. And she directly attributed the lack of information that they were receiving to their ability to effectively treat the virus and their patients, specifically noting that if there was more guidance on the issue of patients who are not showing symptoms, then they might have treated those patients differently during March and April when we were having the virus. So I think there are infectious disease experts, and I think she mentioned something about relying on the CDC, but our own city agencies who are looking into these issues and advising different parts of the city about how to deal with health, particularly in the area of infectious disease, should be providing accurate, timely, effective information as quickly as possible. And it's hard to say anyone is responsible for the whole COVID-19 pandemic. I doubt that would be the case, but we can all try to make things work a little bit more efficiently. And I think that was the goal of my statement.
Okay, so that's where I thought you were going with this, but it's been something that I'm certain everyone on this call and many they know have been watching what's been said in the news by the governor and the mayor, but it's a general, but the city and the state, I don't think the right word is, but they follow the advice by the CDC and others, and that information, to quote the governor of about 2 or 3 weeks ago, that information was changing daily, what was important and what was known and what was not known. So I don't know how much of that trickles down to a district needs statement. That's what I was asking you to elaborate on that.
If I may, this is Alejandro. I think I see John's point. I think though, after having lived through this first wave of it, and I really do hope there isn't a second wave. It's hard to believe there won't be. I can't imagine moving forward post pandemic and not wanting a priority to be to see the plan. I want to know what the plan is for the next time this happens. Not with this, but with the climate change thing that also leads us to be trapped indoors and have to not go to work for months, or the next zoonotic illness that transfers over. These things are going to happen in our lifetime again, probably, some way, shape, or form. And I believe that that sort of like plan of action needs to be elucidated for a general population. And I don't know if you, maybe John, your point is that that's not a place for, that's not, it shouldn't be in the district needs, but as having been one of the districts that was hardest hit, I think we have a leg to stand on to ask for some sort of explanation and preparedness plan.
Yeah, absolutely.
Preparedness is always a good thing for an emergency. I hear you, Alejandro. The district 2 was hit very hard, as was the one in the Boundaries in Flatbush. Again, I think that the city responded to the information that they were given, and as things in the state responded as it was given, and as things changed, they had to change. However, that being said, with you about the need for a preparedness, I'm not sure about, I guess ultimately it comes down to a plan, but I read something because, as I mentioned, I was a little late from work because I'm going in every day. And the last week it's been going through the protests. So it's never sure how long the bus ride is going to be. But be that as it may, there was an article, and it's not related to COVID, but it is related to your issue about preparedness. And it said, and it was from experts, and it was experts in the city, and it was experts in the state, and it was experts in the federal government. And it was talking about post-, I guess it's, but at that time it was like 5 years out or something. It was an anniversary date. I may have the length of time, but they said that basically, in many ways, the city is no better prepared than it was a day or a week or a month before Sandy. And so you're, in that respect, in the larger respect, your point's a good one, because I think that generally speaking in this city, we try to deal with a problem, or it's an environmental problem.
You ain't gonna die, you'll be all right.
Or it's a social service problem, but we kind of react. We kind of respond by reacting to, here's the situation, now we're gonna do the best we can. But preparedness, it's not something that the city has been very good at a whole lot of ways for a long, long time. So I hear you. I'm just not sure how that would manifest in a district needs statement, because I think it's good that we raise that. But I think when we talk about preparedness for COVID or preparedness for another horrible storm like Sandy, I think it's almost by nature a larger thing than just the district, right? And the borough. So I'm just putting that out there.
Okay, that's fair. Well, do we have any other things to questions on the district needs statement? I think we were going to take that offline a little bit, but I didn't want to cut anybody off. All right. Not hearing anybody. I'll move along to our my chair's report. I'll keep it pretty short tonight. The one thing I did just want to acknowledge, and it's kind of sad to acknowledge, is that unfortunately one of our prior committee members, public member Winston Clare, passed away due to the COVID-19. I was very sad to learn that news during the time when about a month or two ago, and I just wanted to recognize him for being an excellent public community committee member, and who was a very gracious, caring man. So I don't mean to do anything dramatic about that, but I wanted to make sure everybody was aware of that. And I hope those of you who remember Mr. Clare will remember him with the same kind thoughts that I have for him.
That's good. Thank you.
Want to move along to what have we got next? Other business. Do we have any other business to discuss? Members of the committee? Anything that anyone else wants to raise?
I just want to share that I think I saw on Twitter that there's a visual at 1 p.m. in Cadman Plaza tomorrow. And I think that George Floyd's brother will be there, if I saw that correctly. So just since that's in the district.
Yeah, I read that also. It said his family was going to be there. I don't know who that actually is, but it was in Cadman Plaza Park.
Yeah.
Then the attendees, if they wish, will be marching across the Brooklyn Bridge for an event. I forget where exactly in Lower Manhattan. I don't remember. But that's what's planned. I don't know when the event will actually start. These things never start on time, and I don't know how long it'll actually last at that. I can tell you from living right here, police presence will be enormous. We had an incident where I live in Concord Village Saturday night when protesters were marching across the bridge from Manhattan into Brooklyn. I think they probably wanted to go to Barclays or Grand Army Plaza, and the police must have been on orders to not allow that. So they were cutting them off. The marches, peaceful marches, were being cut off before they could and continue heading south. And they were dispersed all over the place. And at points I saw from my windows, the marchers looked like they were running for their lives. They looked really scared and were trying to run wherever they could, getting very little guidance and support that night from the police. We spoke to the police Sunday morning because a few things happened on our grounds, which were inadvertent. Nobody was planning to do any damage, but it was kind of messy on the grounds. So we spoke to police, and Sunday night was completely different. Marches came across the bridge again, but they were diverted up towards Cadman Plaza, towards the park, and surprisingly towards Brooklyn Heights, perhaps. But they were from Concord Village. So selfishly, Concord Village didn't encounter any problems, but I also did not see the same chaotic activity as a result of anyone's that occurred Saturday night. It was totally quiet and kind and peaceful. And last night, protesters were marched, the night before, rather, protesters marched into Manhattan along the Brooklyn Bridge. So police were just escorting them very peacefully. And then last night, protesters went to the Manhattan Bridge, and police were also there in force, but there were no incidents. It was peaceful. Police were very professional, and it went fine in this area. So all I'm saying is I think it'll go fine tomorrow, but there will be a very enormous police presence. So if any of you are thinking of going or attending or whatever, don't be freaked out if you're not used to seeing a lot of police, a lot of gear, because that's like what's being done at this point in time. And so far, it's being handled much better than it was a few nights ago. I'm sorry for going on that long.
That's okay, Barry. I remember that exact incident as well this weekend, and it was pretty much exactly as you described it. I know we have another section called Wellness Check of our agenda, which I feel like we're getting into a little bit, but on the subject of other business for the committee, do we have any other business for the committee? I just wanted to sort of move on from that section if we could. Okay, hearing none. Wellness check. So Carol Ann, I'm not sure what we had in mind for this specifically, but were we thinking like just trying to check in on everybody and see how they're doing?
Yeah.
Okay.
It's like, it's just been a while since we've seen each other. You know, anybody have any news they want to share? How have they been? New family members, you know, just touch base in these trying times.
I can tell you for myself and my family how important park area and green space has been, because it's a place to be able to go to. It's a place to be able to sit around and just relax and still keep social distancing from other people. I'm talking about Cadman Park specifically, and then there's also Whitman Park, which is just off the street. People are making really good use of it, and most people are, being appropriate and being safe for themselves and for others, which is kind of very heartening to see. So I just, recommend for those of you who are able and so inclined, it's good to get out for a bit. It's good to do some, even if it's very moderate. If nothing else is better than nothing. Wear your masks, as annoying as they are. As I hate them, we're wearing them religiously, my wife and I, and our grandkids and daughter and son-in-law. And so far, knock wood, all of us have been okay specifically. And I think I attribute it to the fact that we're just being very careful, and following the protocols that have been finally, more fine-tuned than they had been originally. All I can really say is washing your hands if you've been outside or touching things that are not in your home. Please do that, and do not go to your mouth or your nose or your eyes unless you've washed your hands, because those really are the porticles, or whatever the word is, for infection to enter your body. Um, and kindness goes a long way. It's much easier to be kind than not, and there's a big payoff for it, for whoever you're being kind to, as well as for yourself. And that's my speech on wellness thing. I just also want to thank you, Carol Ann and Brandon, for even coming up with this notion of a wellness check. I think it was a very beautiful idea, and it's much appreciated.
Thank you, Barry, for that.
Thank you, Carolyn. I agree. Parks have been really helpful. Every weekend, all weekend, I walk to either all through Brooklyn Bridge Park or to Fort Greene Park or even to Prospect Park. And I feel like it's the best free mental health right now in and around our district.
I live on Washington Park, just facing Fort Greene Park. And so in the first few weeks of the pandemic, we had our routine. Because my partner is working full time, and so I was sort of primary care parent, and I would take the kids for a morning walk and an after lunch walk, and it was much easier. And then there was that period at the end of March and early April where they said this is the peak, this is where we have to be extra careful. And I think until that point, I thought, well, it doesn't matter where we are as long as we, as Barry said, follow our rules, right? We don't touch our faces, we wash our hands, we wear a mask. But it does start to play with you. So for about 3 weeks there, we didn't leave the house. We went up to the roof, which is completely unsafe, but we needed fresh air. And we would just sit up there, and occasionally I would take the children outside to the park. But even then, I feel like it wasn't until early April that people really committed to wearing the masks in Fort Greene Park and into keeping their distance. So it was kind of a trying time for those. Luckily, our kids didn't really care much, and we've introduced video games, so they really don't care. But I got to the point where I thought, am I ever going to leave this apartment again? I mean, I would do all the food shopping, because I don't trust my partner to be as careful as I am. I don't trust anyone to be as neurotic as I am. so I did all of the food shopping. So I would go out and get my fresh air, but it was always under such duress, and so it's interesting because the effect of the disease on the body has not changed. When it hits you, if it hits you bad, it's going to be bad. But my anxiety and my vigilance has definitely decreased, And so there are moments when I think, oh God, am I opening doors here? I don't even realize I'm opening to this thing. And, but otherwise we're doing okay. I worry mostly about the people who don't have everything that we have, which is, what feels like an endless supply of food, mostly pasta, and space, and a park nearby. So yeah, I think that's primarily it. I will say one more thing, just going back to this preparedness plan, because several comments since then have tied back into it. And I wonder if there isn't a way, at least from our little geographic unit of the district, to be creative about how we could push for more preparedness, because it's in everything. I think the powers that be would have us believe that, like, this is so out of the ordinary that everything that happens, every single thing that happens, it's doing the best we can in the moment, whether it's the fiscal stuff or the police stuff or the disease stuff. But everything has research. Everything has a community of researchers who focus specifically on things like crowd control, specifically on things like viruses and epidemics, specifically. And sometimes I think that the failure has been mostly not listening to the people and not having those teams of people at the ready and trusting them. I'm lucky because of my public health background. I'm on lists with mostly epidemiologists and virologists and biostatisticians. And in January, I was panicked, In early February, I was begging the principal of our school to just talk to someone to say we need to close this down. I'm just a private citizen who doesn't work at the health department. I shouldn't know more than the mayor of New York City. And that's what's been really frustrating, Even just seeing the police response when I see it's just, there are people who study this for a living. If you get confrontational, guess what? You're going to get a group of anxious, angry people to become confrontational right back. So anyway, what I'm getting at is just that I hope that in the future, all of these different areas are, there's a wonderful task force that looks back and sees what we did right, what we did wrong, and plans for better.
Very well said, Alejandro. I agree with you completely.
Did anybody else want to share their perspective? I feel like we're getting towards the end of agenda, and some people are interested in departing. Tanya, if you'd like to depart, that's fine. I totally get it, but it's really nice to see you, and thanks for being part.
I'm on a call with the NAACP.
I would just like to say one thing, that we're trying to reach out to the superintendent of the district to find out more about what the plans are for the children in the summer and the fall, because there's been lots of rumors and it's not clear. Talking about planning, Alejandro. Yeah. So I'll let you guys know if we do get a Zoom thing with the district superintendent. That could be helpful.
That would be great. Thank you so much.
Oh, thank you, Betty.
It's a pleasure always.
All right. Well, as we're now a few minutes past the 8 o'clock hour, and looking at our agenda, we're at the final point, community forum. I must ask and encourage anyone from the community. I don't know, Sonia, Eileen, did you have anything you wanted to say before we broke for the evening? And feel free to jump in. Oh, Eileen, your chat comments are most welcome. Not hearing anything else. I will take that as the community members do not wish to make any more of a comment than Sonia and Eileen's eloquent comments in the chat. With that said, I will entertain a motion to adjourn. tonight's meeting. Alejandro, second from Tanya. All in favor? Aye. Opposed, abstentions, goodbye. We'll talk soon.
Thank you. Thank you, Brandon.
Thank you all. Thank you, Carol Ann. Thank you, Jessica. Thank you, everybody.
Thank you, Jessica. Carol Ann?
Yes.
What was the thing about CBPR that I was sort of reading, but I didn't?
CCRB. I believe